Well, if that's the career path you want, there are a number of things you can do. First of all, I really think that to be effective in that role, you should have some clinical experience. I know that's controversial, but there's nothing that beats patient care and patient interaction in defining your purpose and defining what kinds of questions really need to be answered and how they fit with this grander goal, as I put it, of becoming involved in human empowerment. The true value of research is only realized if it results in the patient understanding care better, understanding the basis of their care, if it can be an effective communication tool, not just with patients, but perhaps even more importantly, with policymakers and with individuals who are in control of the political system and the financial system. Um, Thought leaders, not just politicians, but individuals. Uh, we see a lot of sports celebrities, we see a lot of entertainment celebrities, people in the music business that are all chiropractic patients. Almost all major athletic teams have chiropractors involved. So the value in research is showing that there's so much more to chiropractic than merely the episodic symptomatic treatment of pain syndromes. Helpful as it may be, um, chiropractic isn't about treating pain, it's about empowering people to realize their potential. So, first and foremost, I'd say establish a relationship with a practicing chiropractor, shadow that person, and see what kinds of challenges they're facing with patient communication. Learn something about patient education strategies, what they're using. Some doctors do it very well, some don't even try. Um, Find out what it's like in the real world. Indeed, shadow a couple people if you can. Um, in terms of pre professional preparation, it really helps to take some of the hard basic science stuff before you get to chiropractic school. Um, I was speaking with a friend of mine who's on the staff here at Sherman College, and he has uh, a mentee uh, who recently graduated. And he said that the best advice that he gave this fellow in terms of how to get through was take the undergraduate biochemistry course so that when you get here, you're not struggling with it. Take a course in anatomy and physiology so that you kind of understand the grand scheme of how the body works and what the major structures and functions are. But in the context of research, same advice. There are a lot of undergraduate research opportunities out there, and we get students who come here with some experience. Um, you may find yourself in a variety of roles, ranging from feeding the animals to doing reviews of literature to assisting with the collection of experimental data and so forth. But if you have an opportunity to get involved in an undergraduate research program, at your college or university, by all means do that. For example, here in South Carolina, in our area, we have uh, the Upstate Research Symposium, which is designed for undergraduate students to give them a chance to submit papers for peer review, um, to do poster and oral presentations. I think we have something like over 30 institutions participating, and there were over 100 papers presented last time. So these opportunities do exist. See what's available locally, and if you can, get involved. And you say, well, gee, isn't this going to take up a lot of time? You're asking me to shadow a chiropractor. You're asking me to get involved in a research project that perhaps isn't part of the core curriculum. And the answer is yes, because another thing you need to prepare for is the rigor of the DC program. Um, this isn't a situation where full time is 15 credits, where you're in class 15 hours and maybe spend 5 or 10 hours a week in preparation and then cram for tests and fly through. It's a program where you're in school all day from like 8 to 4:30. And it's a program that involves some very rigorous basic science study. And when you get into the clinical phase of your education, you need to spend time in the outpatient clinic and so forth. So get used to making a total commitment to your professional future and getting used to spending a lot of time doing that. But the
Mm-hmm.
very good news, at least here at Sherman College, is that we do have a commitment to at least give interested students opportunities to participate in research. What we have in the regular curriculum now are three research courses which deal with evidence informed practice. And although they're designed primarily to make students good consumers of research, individuals that know how to search literature, individuals that can separate good papers from mediocre papers from truly awful papers, individuals that can apply the concepts of research to clinical practice, reliability, validity, sensitivity, specificity, clinical and statistical significance. All of these things are very important in designing your own clinical protocols and to critically evaluating the claims of people who are promoting techniques and people who are promoting various forms of management.
Mm-hmm.
When you start to develop these critical thinking skills, not only is it invaluable in clinical practice, but we also can see these things applicable in the real world. I said, yeah, goodness. Now everyone's talking about COVID-19. Will testing save us? Will vaccines save us? Well, let's take a critical look at the research. Let's look at how good the tests are. Let's look at some of the potential uh, statistical phenomenon that seemingly everyone in public health is overlooking.
Mm-hmm.
Um, don't want to get into the details of that, but there are some real world applications that even go beyond chiropractic, but are necessary uh, to just function in society and certainly to have a role
Mm-hmm.
as a teacher, which is what doctor means when you're in clinical practice. The
Mm-hmm.
other thing that we have available, besides these courses in the core curriculum, is that the Foundation for Vertebral Subluxation has sponsored a number of research fellowships for students that are interested in becoming involved in this. They include scholarships, modest stipends to help defray tuition expense, in exchange for which people work on our projects. For example, I have in front of me a paper that's been several years in the making on the prevalence of abnormal findings in 737 patients referred for MRI exam by doctors of chiropractic, and how these can relate to neurological consequences in vertebral subluxation. And I was assigned a research fellow who helped me with a lot of the somewhat tedious work in preparing that paper. The foundation is also involved in an immune system project where we hope to develop a practice based research network. So, in addition to full time researchers, where unfortunately funding is somewhat limited, uh, if you do elect to go into clinical practice, you have a number of research opportunities there. One, of course, is case reports, and another one is collaborating with a practice based research network where you collect clinical data which researchers can then utilize. Uh, and we're really hoping to get this off the ground where we have chiropractors relating objective measures of vertebral subluxation to various biomarkers associated with immune function. So the exciting thing about that is that we're not looking or limiting our perspective to specific diseases. We're looking at the unifying systems of the body uh, and the intimate communication between the nervous system and the immune system makes this very exciting. Another area where I have an interest is chiropractic and mental health, and we have some stuff on that that may be of interest to you. If
Mhm.
you're interested in seeing some of the stuff that we're doing at Sherman College, just go to sherman.edu, click on research, and there are a number of videos there of presentations that I've given about vertebral subluxation, about chiropractic and mental health and related fields. And we also have a list of the projects that are currently undergoing here at Sherman, as well as publications from the last, I don't know, 7 or 8 years or so. So
Mhm.
those are resources